Our guest today is case manager at the Wound Clinic. Registered nurse Todd Walburn joins us today for Health Information Please. Welcome back, Todd.
Hi, Mike. Thanks for having me.
I'm glad you came back today to tell us about this very important part of HaysMed, the wound care clinic. Let's start with some basic information on it, if you would, Todd. Tell us about the wound care clinic, what it is, who it serves, what its purpose is.
Our wound care clinic at HaysMed is for patients with chronic wounds. And when I say chronic, that means wounds that are have been around for longer than 30 days without healing like they should. So most of us can heal a wound if we have one. If we step on something, we get a cut on our hand, a cut on our foot, a ingrown toenail, something like that. Most of us can heal that type of a wound within 30 days.
So the time frame is 30 days, basically, for a wound that doesn't heal properly.
Heal, yeah. And some people, battle wounds for, we've had a few that have been battling wounds for up to 4 years. And they come and they go, and they almost get healed, and then they get worse again. And we just help them kind of figure out what they're doing, why they have the wound, and then go about setting up treatment options for healing that wound and progressing it along so that it does heal and they can get back to their normal way. Their normal way of life.
Well, Todd, I remember from past visits that you've had with us about the wound care clinic that sometimes they can be minor wounds that just simply don't heal, or they can be something major like a trauma. And today we're associating some of that with diabetes, but also it could be in a traffic mishap or something like that, or something around the home that causes a larger wound than normally we experience.
Yes, yeah. A lot of times in the summertime we'll get somebody that'll come in and say, oh, they were out at the lake and they stepped on a rock at the shoreline, and now their wound just isn't healing. So we do some investigation. We put on our detective's hat and we try and figure out what it is that happened. Is it infected? Is it something that the person already has going on in their body that they didn't know about? Maybe they're in that pre-diabetic stage where things are starting to get a little different for them in their body as far as healing and maintaining stuff. So we put on that detective's hat and we really kind of dig into the problem, and we specifically focus on the wound and how to treat the wound. So,
can the wound be on most any part of the body, Todd?
Yes.
Okay.
We've seen patients with it on the top of their head from too much sun exposure and having to have cancer removed, and then that spot doesn't heal well. We see it down to patients' toes because, again, they get an ingrown toenail or their toes are contractured a little bit, they rub inside their shoes, whatever it might be. We've had them on patients' fingers, elbows. We've had a couple of surgical wounds that didn't heal quite right from the abdomen area. So all over the body, not just in one location.
I would assume that there is more potential for wound damage or accidents in the summertime. Is that a fair statement, or is it pretty much year-round?
It's pretty much all year round, but we do see a few more in the summertime because a lot of people take their shoes off and go barefoot. And so sometimes you step on a rock the wrong way. For a diabetic person, they may not feel that when they step on that rock the wrong way because that's part of the complications of diabetes is they lose the feeling, some of the feeling, if not all, in their lower extremities, in their feet, their toes. So they just don't know that they stepped on that rock and it caused a problem. And so then since they don't know, then it gets infected and it gets to be a bigger wound, and those take time to heal.
So in a matter of a person who's dealing with diabetes, they may not even be aware of that wound then.
Quite oftentimes they're not. At the time of the injury. It's not until sometime later, maybe they're taking their socks off a few days later, and maybe they work a job where they have to wear dress socks that are dark colored. They don't notice it until maybe the weekend when they put their white athletic socks on, and they take their socks off that night, and there's a red spot on their white socks. We try and encourage most of our patients with diabetes, if we know they have diabetes, to try and check their feet every single night. And that's as simple as having a spouse or significant other check it, or just taking your mirror and looking at the bottom of your feet, because not everybody can grab a hold of their foot and turn it upside down and look at it, So sometimes you need that extra benefit of having an assistive device.
That, huh?
Quite often. So I can still do it myself, but I'm noticing that I'm having difficulties getting my foot to the right position to see all the way around it.
Let me give you a little update here. There will come a time when that will not be feasibly possible.
I know. Physically. I know, right? Exactly.
Just to warn you ahead of time.
And we know that ourselves, so that's why we encourage our patients to get a hand mirror or, have somebody else check it for them in the household. So.
Once a day is a good idea.
Once a day is a good idea.
All right.
Because, again, you never feel that injury, and so you may stick your foot down inside of your tennis shoe and your cat dropped your kid's Lego down inside, and you may not feel that Lego inside your shoe, and it's putting all that pressure on your toe or on an area of your foot. You don't feel it, and it causes a really bad wound. And it could be something as simple as that.
Wow. So there are all kinds of scenarios that you at the Wound Care Center have seen that have happened to people just by accident.
Yes.
Oh, my goodness. What about ages? What kind of ages are appropriate for treatment at the Wound Care Clinic?
Well, we've kind of seen all ages. We've had as young as a 3-year-old, and we've had an over a century-old patient. So
even young people who we normally think heal faster, perhaps, can still experience some difficulties with wound healing.
Yes.
All right. Where's the Wound Care Center located, Todd?
The Wound Care Center is located at HaysMed complex itself, and it is in the lower level underneath the DeBakey Heart entrance.
Oh, okay. So you'd go into the DeBakey entrance then, which is parking lot A, I think.
Parking lot A, correct.
And then go take an elevator down?
Take an elevator downstairs, and then we're just a few steps away from the elevator there. Now, if you're driving yourself and you're not able to get around real well, you can still go to entrance B, the Miller Pavilion entrance, and we have the courtesy parking that's available there. So you can still go in there, and then one of the volunteers that sits at the entrance B will help get you down to the wound center, and then we'll get you back up to entrance B again to the Miller so that you can leave again. Boy,
that has been a nice addition at HaysMed. I'll tell you, the parking assist, helping with finding the right location you're supposed to go to at HaysMed, the visitor center has been really a nice addition.
That's a very nice service that the hospital offers, is that patient-assisted parking. So we encourage our patients that need that mobility assistance to go ahead and take advantage of that.
Well, now, Todd, what about the reference to the wound care clinic? Does it go through a primary care physician? How does that procedure work?
It can go through your primary care physician. If you have a wound that you've been battling for a while, you want some extra help on it, you and your primary doctor are just at your wit's end as far as what else to do to get this wound to heal. And then your primary is more than welcome to make a phone call to the wound center, and we'll get some information from that phone call and then give the patient a call and schedule them.
Is it normally a Monday through Friday scheduling type scenario, Todd?
It is. It's a Monday through Friday. In our clinic, we like to see patients back weekly. We want to track their progress. So we want to make sure that they know that up front, that, we're going to see you. We'd like to see you weekly, because we want to see if the treatments that we're doing are beneficial. There's no good use for us to think that this treatment A is going to work for all patients, and just go, here you go, do this, and we'll see you in 3 months. And that doesn't work. So we ask them to come back weekly, and that way we can track the progress, and we can make sure that the wounds are getting cared for outside of our clinic with the correct dressing changes, that they're not getting too wet, they're not getting too dry, anything like that. Because too wet a wound, it slows down. Too dry a wound, it slows down the healing.
So you go through the procedure then for once they are out of the wound care clinic at home and such, to be able to manage on their own and then come back in a week to make sure the progress is sufficient to what you want it to be.
Correct. Yeah, our services are all outpatient-based in the wound center, and so we want to make sure that we're coming up with a treatment plan that the patient and or the patient's family or somebody else that can help assist with the dressing change if needed are able to do appropriately. Because the best thing for healing is to do the treatments the way that they're intended for. And so we want to make sure that if we say do it this way, that it's done that way, and that somebody doesn't wrap it too tight, wrap it too loose, let it get too wet, too dry, like I said before. So being able to maintain the environment, and that's what we're finding in wound care through all kinds of research, is that the environment that you maintain around the wound is what really helps set it as far as into its healing phases.
And these are tried and true methods that you've been able to develop and see with good results over a period of time.
Correct. And it's not just here at HaysMed. It's getting research from all over the United States and some of the foreign countries that are also doing wound research. I mean, everywhere that people have wounds, so everybody's trying different things and experimenting and seeing if these things work, seeing if these things don't. We take some of that information and we incorporate it into a personalized care regime for each patient.
And much like all of the other disciplines at HaysMed, your procedure and your methods of treatment go to the individual, that it's designed for one person may not be the same for the next person.
Correct.
Todd Walburn is our guest today. Todd's a registered nurse. How long have you been at the Wound Care Center?
I have been in the Wound Care Center for 5 years now.
5 years, wow. Todd's been a frequent guest, and we wanted him to come during Diabetes Awareness Month, which is the month of November, because this diabetes management is an important thing, and you've already alluded to some of the issues that diabetics face in addition to all of the other things, the management of their blood sugars, their insulin regimen, their worry about extremities, heart conditions, strokes, things like that diabetics are aware of and have to manage from our other guests that have appeared. But wounds are something that are really a vital part of management, aren't they, Todd?
Yes, they are. We see, I think the last time I checked it, about 40% of the patients that we see in the Wound Care Center have a diagnosis of diabetes. Now, it may not be the cause of why their wound isn't healing. Again, it kind of depends on the location, but it has some effects on their healing. So we just want to make sure that during this month of diabetes awareness, that those patients that are diabetic, those family members that have significant others that have diabetes, that you're just checking on those people and remembering those small little things that just go along to help. And like I said, that's making sure that you check your feet daily, whether it's in the morning or whether it's in the evening. If you can do it twice, that's even better. But we know most of the time, while you're sleeping, there's not much trauma that happens to your feet. That you're not going to step on something while you're sleeping or anything else. But at the end of the day, it's always a good idea. Want to keep your feet clean and dry. Want to make sure that they're kind of moisturized with a good lotion, because diabetic patients have a tendency to have their feet, especially, dry out. And that dry skin will crack. And that crack is a way for a bacterial infection to set in. And then all of a sudden there's a wound again. And again, it's just a simple little thing. You wouldn't think that a little crack in the skin would do that. But because of the not being able to feel their feet, feel the pain that's caused by that open wound, they don't know it's there until it's really gone, and maybe it's starting to smell, and that's what makes them aware of it. You just never know for sure. So during this month of November for diabetes awareness, we just want to bring people's awareness to what's going on, how wounds are part of that, and how in wound healing then we can help those diabetic patients get their wounds healed so that they can continue on with their daily activities.
I would think, too, Todd, that the sooner somebody discovers that there is a wound, when it's smaller, it's going to be easier and quicker to get relief from and treat.
Very true, very true. If we catch it early, number one, it usually hasn't grown too big in size. So the smaller the wound, the quicker it should heal. If we catch it early enough, then we can reduce the chances of it causing a whole body infection. A big piece with diabetic patients, especially with feet wounds on the foot, is that they develop what's called osteomyelitis. And that is an infection.
I'm glad you said that, so I didn't have to.
That is an infection in the bone. But there again, they don't know that they have a wound on their toe, and so the wound is open. It gets deep enough that it actually gets to the bone. The bone gets exposed to air and bacteria, and all of a sudden an infection happens in the bone.
Oh, wow.
And so when that happens, then a lot of times patients have to go to orthopedic surgeon or a general surgeon and have the toe removed.
So the sooner the better.
Correct.
When it comes to wounds.
Correct. And in wound care, we hope to kind of help minimize that need for that amputation because we have some treatment plans that that offer treatment options that steer patients away from that having to have that amputation. So there are times where you can have that infection in that bone. We can do some treatments within the wound center, heal that infection, treat that infection, heal the wound, save the toe, keep the patient with all 10 of their digits.
Wow. That's an important point. I'm glad you made that, Todd, because some folks might think that if they have a serious wound, that the answer is an amputation of a digit, and that is something that you would put at the very bottom and want to try to avoid at all costs.
Correct.
That's good to know.
Part of the reason in patients with diabetes especially that they have to do the amputation is because the little vessels down in the toe, the little capillaries, the ends where the arteries and the veins kind of mix together and all of the transport of nutrients and oxygen happen, those little areas, those little capillaries get clogged. And so they stop performing. So you're not getting as much blood and as much oxygen down into that area. So really, if you just amputate the toe, if that's the case, then the other toes, the other areas of the foot around it are still suffering from the same thing. Those capillary beds are still clotted off a little bit, and you could develop another sore on another toe now that's going to cause another amputation. So once you start with an amputation, sometimes you just keep going, and the next thing you know, you're below the knee, and you have to have some type of a prosthetic. So
again, the trick here is to deal with the wound early rather than putting it off or not being aware of it.
Correct.
Todd Walburn is our guest today. Todd is case manager of the Wound Care Clinic located in the lower area through the DeBakey Heart Institute at HaysMed. As Todd said, that's parking lot A. And if you do need parking assistance, the Miller Medical Pavilion location, which is parking lot B, would be the place to go in. And there are parking assistants as well as someone who would be able to get you to the proper location. Questions about wound care? Whether it's if you're managing diabetes yourself or maybe a relative or a friend or neighbor. If you'd like to find out more information, here's your chance, and you'll be talking with registered nurse Todd Walburn. Todd is case manager of the Wound Clinic at HaysMed. And our numbers are 625-1114. If you're outside the area, joining us on KVGB or Eagle Community Television, or Hays Post, or the new app store in the iTunes apps, or the Google Play Store, 94.3 KAYS. Call now. Lines are open, 785-625-1114. Or if you're in the Hays area, simply 625-1114 should get the job done. You'll be talking with registered nurse Todd Walburn for the Wound Care Clinic at HaysMed, 625-1114. And again, if we happen to be talking about a particular area, you're certainly welcome to call. As I told Todd before the program, we always learn a lot here on the program from the questions that you ask. So it's good to ask those questions, and particularly if you're managing diabetes in your family, here's a good chance to find out more information about the wound clinic at HaysMed with the case manager and the supervisor, Todd Walburn. 625-1114, or outside the area, 785-625-1114. Lines are open. Give us a call. We'd like to have your question on wound care management. And if you're not troubled with diabetes or having to manage diabetes, or simply want to find out more about wound care, here's your chance to do so. 625-1114, or outside the area, 785-625-1114. This is Health Information Please, made possible with the support of HaysMed on KAYS, KVGB, Eagle Community Television, and the HaysPost.com location, along with the iTunes App Store and the Google Play Store. 94.3 KAYS. Lines are open. Call us now. So, if, Todd, we get into a situation where we get a wound, say a paper cut, accident happens, something in the garden where we're cleaning up for the fall or raking the leaves or whatever the case may be, or in, just simple household things that might happen, and we get a wound ourselves, is it possible, it's not an automatic necessity to contact the wound care clinic. Can we deal with some of those ourselves?
Some of those you can. Again, we're there for the chronic wounds, so those wounds that have not healed like they should have in over 30 days. Mm-hmm. So a scrape out in the yard when you're doing yard work. I think we had a caller last time that called in and was saying that they had been pruning some roses and got a scratch on the arm. That's not typically somebody that I would see in the clinic that I work in. Mm-hmm. Now, the exception to that is that we do, since we don't have a burn center anywhere close, we will see some minor burns, and those are more just happened recently, and we can work with those patients to get their burns to heal a little quicker and with a little less pain than possibly, on their own.
What's our method of attack here on these wounds ourselves then, Todd? What do you recommend from your expertise at the wound clinic?
Well, with any type of wound, when you first notice it, you want to give it a really good wash. Mm-hmm. So if it just happened, or if you were, like I said earlier, just taking your socks off and seeing something on the bottom, on the bottom of your foot, you want somebody to give it a good wash. Mm-hmm.
Soap and water, or
soap
just
and
water?
Soap and water is good. We want to get any dirt, any contaminants out of there. And then after that, you want to cover it, and with whatever type of dressing you might have. There are over 3,000 different dressings on the market right now for wound care. So for me to say one works better than another, I can't really say that. Mm-hmm. We use a few particular ones within the wound care center, but anything, for a just happened wound that you can buy over the counter at Walgreens, Dillon's, Walmart, wherever it might be, those things are going to work just fine.
Well, yeah, that 3,000?
3,000.
Oh, my goodness. Well, I kind of could believe that, because I think last time I looked, there are probably 24 different kinds of bandages.
Right.
What we used to call Band-Aids, the generic name now, I guess. There must be 24 different types of those.
Yes.
And then you go up from that.
From that.
Wow. That's pretty amazing.
So just wash out, cover and protect. A little antibiotic, triple antibiotic ointment, something like that is never a bad thing. Mm-hmm. Neosporin does a really good job of promoting theirs, that you'll heal so much faster if you use their product.
But let me clue you in. There's a generic that has the same ingredients.
Exactly.
That's about half price.
About half the price. And Walmart and I think Walgreens both make their own version of that, so you can pick it up at any of those locations.
Dillon's has it too, as a matter of fact.
So yes. But those are the big things, is to wash it out, make sure it's clean, keep it dry and protected with some type of a covering, and then, if you need to add a little antibiotic ointment to it, that's fine. Like I said, wounds are kind of fickle in that they need just the right amount of moisture, so we don't want to leave them open to air, because then they get too dry and they slow down on their healing. But if they're really kind of wet and draining a whole lot, then you might have to change the dressing a little bit more often, because if they're too wet, then it's not good. We've all had a little paper cut, like you mentioned, on our hand and done the dishes. And after we do the dishes, you look at where that paper cut is, and you have two little white lines. That means those wound edges where that little paper cut got too much water to them because of the break. Water was able to get in, and it gave too much water to that one little area, and that's not good for the skin.
So you cover the paper cut. Even something as simple as a paper cut, you need to cover it.
Right, and that could be, with a Band-Aid, which, again, a Band-Aid's going to get wet if you put your hands down in the water, so then that Band-Aid or bandage brand is going to hold some of that moisture in. So sometimes you can use like a skin glue.
Oh, yeah.
Something like that to keep and protect that wound so that it doesn't get dirt into it, because that's really the whole reason for covering a wound is not only to keep the dirt and stuff out, but it's to keep the good stuff in the wound, and we're finding out that the temperature that the wound is kept at, it plays an important role in healing also, which you would have never really thought. But if you're taking a bandage off of a wound all the time, it takes about 4 hours for the cells within that area to get back to doing what they're supposed to be doing. So we want to cut down on the amount of dressing changes that we're doing. We don't need to look at one every day. If you've got a cut on your hand, sometimes, again, those skin glues are good, because then you're not having to reapply a Band-Aid all the time because you're washing your hands. For us nurses, that's a big thing, because we're always washing our hands between patients. So we want something that, again, a bandage is just going to hold that moisture in, and it's not going to allow us to keep that clean environment, where if we do some type of a skin glue or a transparent dressing over the top of it that doesn't let moisture penetrate, then we're doing a better job of protecting that wound and being able to still clean and wash our hands.
Well, I was going to ask you about that, because I wondered about how often, if we, are treating a wound at home that isn't a real serious wound that would demand a visit to the wound clinic, if we're doing our own treatment, how often we should change the dressing. But as far as Band-Aids go, or bandages, leave them on rather than changing them frequently, unless they happen to get too wet.
If they get too wet, or there's too much drainage coming in underneath of it from the wound, so when the bandage shows drainage coming through on the backside of it, you want to change it. Or, like I said, if it gets wet because you put your hands in the water or you washed your hands, you want to change it. So anytime that it gets wet that way. There are some different dressings on the market, like I said, that are waterproof, that would allow you to take a shower or wash your hands and not have to change that dressing, because it's waterproof, keeps the water from getting through to the inside.
Todd Walburn is our guest today. If you have a question about wound care, 625-1114. We'll get you a chance to visit with Todd. 625-1114 or 785-625-1114 if you're outside the area, joining us on KVGB, Eagle Community Television, HaysPost.com, or the iTunes or Google Play app at 94.3 KAYS. Lines are open. Call now. We have plenty of time for questions. You can stay on the line. This is an information program. You don't have to give your name, but you can stay on the line and ask a follow-up question if you have it for Todd Walburn. Our guest today, Todd, is case manager of the Wound Clinic, located in the lower level below the DeBakey Heart Institute at HaysMed. 625-1114 is the number to call. I'm glad you mentioned that. I think you called it a glue, the kind of liquid, semi-liquid.
Liquid bandage sometimes.
Liquid bandage, yes. That's it. Yeah, that's what I was trying to go for. Thank you. Because I had a situation where a nail had gotten too long and had opened up a little skin where it dried right there at that corner of that nail. And I couldn't keep a bandage on it for anything, because it was too weird, to try to keep the bandage wrapped around a thumb. And so I tried a little of that liquid bandage, and that stuff works.
It does.
It's an amazing product, and stays, like you say, it's waterproof, I think, because it didn't come off. So that's a good potential as well. You talked about treatments at the Wound Care Center. Would you go into a little more detail for us, Todd, about how you approach a situation where a patient comes in, let's say somebody who is dealing with diabetes, since it is Diabetes Awareness Month, or anybody for that matter, whether it's a trauma event or dealing with diabetes. How do you approach that individual treatment person?
Well, again, like I mentioned earlier, we kind of have to put our detective's hat on and find out some history on the patient. What is their current job, or what kind of job did they have in the past? How active are they? Do they still be active? Are they still active? Do they still run after their grandchildren or children? Or are they sedentary? Do they just sit at home in a recliner all day and just watch TV or be on the computer, searching stuff, whichever? We want to see what their activity level is. Mm-hmm. We want to look at their footwear. If the wound is on their foot, we want to look at their shoes. Mm-hmm. We want to look at the other foot to see if the same thing maybe is going on the other foot. Even though there's not a wound over there, we want to look at that other foot and see, is the same type of thing going to be brewing in a short period of time? Mm-hmm. So whatever we do to one foot, do we need to also try and make sure we're doing it to the other? When we look at their shoes, do we need to make a referral back to their primary care provider to write for diabetic-specific shoes? Because only the primary care provider, can write for that and have insurances pay, depending on insurance, for a portion of the cost of the shoes. But
there are actually shoes that are designed to help support diabetic people who are managing diabetes.
Yes. The soles of them are a little bit firmer, and the material that makes up the shoe where the foot goes in is a little bit softer in most cases.
Well, I'm glad you mentioned shoes, because I have heard stories where that has been a major problem sometimes for people with diabetes, that their shoes are causing the wound, like a callus or corn or something like that, mm-hmm. because they just don't fit right.
They don't fit right.
And the person doesn't know it because there's reduced sensation in the foot area.
Correct. Most of us, if we get a blister on our foot, we feel it. Mm-hmm. You put on a brand new pair of tennis shoes and you get a blister on the back of your heel, you feel that. Mm-hmm. But again, in some of those diabetic patients, they don't have that feeling. So that blister forms, it pops. Now you've got that open area from where that blister was. It continues to rub, so it gets a deeper and deeper and deeper wound, mm-hmm. and they don't feel it. Mm-hmm. So again, we want to look. We want to see, are the shoes a cause of the wound? What type of shoes do they wear? Are these the normal shoes that they wear all the time, or are these just the tennis shoes that they grab, but they're a farmer and they usually wear cowboy boots, which are pointed toes, and causes the toes to come close together, and that puts, like you said, pressure on the toenail, mm-hmm. that pushes in then to the other toe on the other side of that toenail. We have to put that detective's hat on and find those things out.
So you're looking at lifestyles of individuals who come in, what their activities are, what their activity level is, and also the type of footwear they're wearing. What other kinds of things are you looking for?
Then we're also checking maybe their lab levels to see how well they control their diabetes if they are diabetic. Mm-hmm. If they're not well controlled, then we set them up with a dietary consult with a dietitian to hopefully get them better to control their blood sugars, mm-hmm. Which may mean that they get to reduce the amount of insulin and other things that they might take.
Which might better help them on wound control,
correct,
too.
Correct, yeah, because the more closely we can keep your blood sugars around that 120 range, the better for wound healing. When they get way up there in those 300s, and we've seen a few 300s, and it's not usually pretty when we see those. Those are the patients that they don't heal. They don't know why they don't heal. But that's part of the reason, is because their blood sugars are too high.
So if you have someone in your household that's managing diabetes, keep those levels around 100 then? Is that kind of the good average? 100,
is the ideal norm. If they're checking it, before they eat in the mornings, mm-hmm. Before they take their meal in the afternoons, whatever it might be, That's the goal. For wound healing, we like to see it around 150 or less, but we want to see it down. Okay. We don't want to see those 200 numbers. Ideally, we'd like to see them around, like I said, the 120, but we'll go up to about 150, and that's when we start kind of lecturing our patients a little bit, talking with them about what other changes can we do. Can we get them to be more active to help lower that? Maybe they're doing the diet really well, but they're still sedentary at home. Maybe if we can get them to get up and just walk around the block or do something like that. You know, it's really nice weather outside right now for walking around the block, but here in another couple of months it might not be so nice.
Well, but there's the Center for Health Improvement that has that marvelous track upstairs there.
That is true.
If they could hit the trail there. And there are some, the Big Creek Crossing and some of the other areas still welcome people to come in and do their daily 30 minutes a day, 6 days a week at least. 6 days a week, right. Yeah, because as they say at HaysMed, you knew I was going to say this, exercise is medicine. And certainly this would help as they become a part of managing their wounds along with the help of the wound clinic.
And you just hit the nail on the head. It's getting the patient to take responsibility and to assist with their wound healing. Because as a practitioner, as a clinician, we can make all kinds of suggestions on how to treat the wound and everything else. But if the patient isn't following those guidelines, then all we've done is just talk to the patient, and we're not really helping them because, again, we've got to put that detective's hat on and find out, what are they comfortable doing? Are they comfortable changing their own dressing? Do we need to find somebody in the community for them, a significant other, a family member? Maybe contact home health in the area that they live in. Maybe it is contacting the hospital that they live in, a clinic that they live close to do their dressing change for them. Some people just don't want to touch wounds, and some people just have an affinity of staying away from feet. Ooh, feet, dirty, bad. Ooh, yeah. But that's just the way some people are.
But very necessary, I found.
But very necessary. Yes. But we want to make sure that what we recommend, the dressings that we recommend, are the patients are able to follow along with the recommendations. So, because again, we can throw all kinds of different dressings at it, but if they're not putting them on right and they're not doing the other things right, then it doesn't matter which dressing we have on there, it's not going to heal. So it's really kind of tailor-making a plan based on everything that we were able to determine from putting our detective's hat and finding out what does the patient do, what do they like, what do they dislike, what are they okay with doing dressing change-wise, activity-wise, and custom-making a treatment plan just for them.
So it's really not only treatment, but it's education that plays into this as well, Todd.
Yes.
The Wound Care Clinic at HaysMed. There's still time for a call if you want to visit with Todd. 625-1114 is the number to call. And our caller for the morning. Caller, go ahead. Talk to the case manager at the Wound Clinic, Todd Walburn. Go ahead.
Any particular lotion better for a diabetic foot?
Good question. Lotions you mentioned to keep the foot moist or soft, the tissue's soft. Any particular recommendations, Todd?
The only recommendation I really have is to make sure that you're getting a lotion that does not have a perfume, a good smell to it. Because if there is a fragrance to it, there is usually an additive of alcohol, because that's how you then smell that fragrance, is by the evaporation of the alcohol. And so what do we know about alcohol? It dries out the skin. So you want a good moisturizing lotion.
Fragrance-free.
Fragrance-free. Okay. And there are quite a few out on the market. There's quite a few generic. There's quite a few name brands. So it's really just kind of personal preference on which one you want to go with.
Just pick the one you want, caller, the one that is more affordable, and also you can look on the label there and it will say fragrance-free, okay?
Okay. I just, like I say, there's a multitude of what to choose for, and I didn't know if you wanted to include any kind of medicine into the lotion or just straight lotion.
Most of the time we want to just do a straight lotion because our dressing is going to be what's going to help the wound heal. And we just want to use the lotion on the area around the wound, not necessarily in the wound. So we just want to make sure that the skin around the wound, the peri-wound area as it's called, is kept moist and supple and is not too dry and cracked, and so that's the main portion of that. So as far as an additive to it, doesn't really have to, because the dressing should be managing the wound itself, and we're just managing the skin around the wound with the lotion.
Yeah, because I don't have any sores. I'm just have like just a dry skin, I guess you'd say.
Yeah. Especially in the wintertime. Well, I'll tell you, a good lotion certainly goes a long way for not only the feet, but other areas like elbows and things like that, too, caller.
Yep. Okay, thank you.
Thank you for the question.
Yeah, that's a great question. Thanks, caller. We have time for one more if you want to call real quick. 625-1114 is the number. You'll be talking with the case manager at the wound clinic, Todd Walburn, during Diabetes Awareness Month. And again, we were talking about treatments. We went through some of the initial areas that you like to do. But each treatment, each individual has some specifics you want to find out about, and then you can tailor a treatment to that individual. Am I on track here?
Yes. So, depending on the location of the wound, sometimes we'll need to continue further offloading of the wound.
What do you mean by offloading?
Offloading
quickly?
would be taking the pressure off of it, so a different shoe possibly.
Gotcha.
Sometimes you'll see a patient wearing a half shoe or what's called a wedge shoe, where it helps to alleviate some of the pressure on a certain area of the foot.
Okay, let's see if we can get a quick question. Caller, go ahead, please. Caller, are you with us?
Yes.
Go ahead.
I'm sorry, radio down. I have been diagnosed as a diabetic, and I have a tremendous problem with itching. Is that dry skin or is that diabetes? What is that?
Dry skin.
Well, the itching could be the nerves. Are you talking in your lower legs? Is that where the itching is, or all over?
No, I itch all over.
Itch all over. It could be the course of the disease of diabetes affecting some of the nerves and causing them to fire and causing the itching. But the best thing to do would be to get with your primary physician and have them maybe run some tests and see is it that you're allergic to something in your environment, or is it, like I said, a cause of the nerve endings being damaged because of the diabetes. I believe there are some medications that can help with some of that, but that's a good question for your primary care physician.
That's the place to start then, caller.
Okay, is there anything that, before I get to my doctor, I have an appointment later on in the month, that I could use their lotion or anything that will sort of, because I hate to, itch to scratch because I don't want to damage my skin.
Correct.
Try lotion,
you can try just a plain lotion, or you could try one of those lotions that also has some medication in it. Since you're just talking about itching, like a Benadryl cream or something like that. There are quite a few different ones on the market, not just Benadryl, but that's the one that comes to mind the most frequent for me. And caller, we've run out of time, but thank you for your question.
Thank you. Thank you so much. Have a blessed day.
Yeah, thank you. We appreciate that. All right. That's our program for today. Todd, thank you for the information. Once again, people can call the Wound Clinic for further information, huh?
Yes, they can. All
right. Wound Care Clinic case manager and supervisor, Todd Walburn, on Health Information Please on KVGB, Eagle Community Television, and KAYS.